Good morning. My name's Janice Peterson. I'm your Master of Ceremonies today. Now, for those of you who don't know me, well, you need to tune into SBS. That's the nation's only multicultural broadcaster. And there you can find me, SBS World News. I read that 5 nights a week, your best hit of local news, international news, but a great way to stay connected. But anyway, this morning I had an offer I couldn't refuse, and that's why I'm joining you today. So welcome to the online presentation of the Multicultural Health Communication Awards 2021. We did it. We made it. It is my absolute pleasure to be your MC once again for these awards. I've been involved for many years now, so it's fabulous to be back. So much of these awards deserve all the recognition, the praise, the accolades. This is a time to recognise and acknowledge the tremendous work that's being done out there in the community and by people in the medical and health sector. So thank you once again for joining us. I want to begin by acknowledging the traditional owners of the land on which we meet today, the Gadigal people of the Eora Nation in my case, and the traditional owners of the land from which you join us from. I'd like to pay my respects to elders past and present. I also want to extend that respect to elders and leaders of multicultural communities. Welcome. The Multicultural Health Communication Awards were established back in 2003 by the New South Wales Multicultural Health Communication Service, a statewide service funded by New South Wales Health and hosted by South Eastern Sydney Local Health District. The 2021 awards recognise excellence in multilingual health communication right across New South Wales Health and health-funded non-government organisations. Ladies and gentlemen, we have a very exciting program for you this morning, and that really showcases our wonderful finalists. But it's not just about us. We need you involved too. So I really encourage you to share your comments and posts with Multicultural Health Communication Awards. The hashtag is hashtag Multicultural Health Awards on the MHCS Facebook, Twitter, Instagram, and LinkedIn pages. And that's a really great way for people to get to know what you're doing, what people in this sector are doing. It would be great to get the word out there. This is a time to celebrate all of the tremendous work that's being done. So I encourage you very, very strongly, get involved. That hashtag Multicultural Health Awards. To officially kick off today's awards program, it's my great pleasure to introduce Mr. Toby Wilson, Chief Executive, South Eastern Sydney Local Health District. Toby's been expertly leading the South Eastern Sydney Local Health District since April 2019, and he's a very huge supporter of the work that the Multicultural Health Communication Service does. Ladies and gentlemen, friends, please join me in welcoming Mr. Toby Wilson.
Good morning, everyone, and thank you, Janice, for your introduction. Can I also start by acknowledging that I'm coming to you today from Bidjigal land of the Eora Nation, and I'd like to pay my respects to elders past, present and emerging, and also acknowledge all the traditional owners of the lands on which everyone is joining us today. It is absolutely a privilege to be here again to welcome you to this year's Multicultural Health Communication Awards, as we pay tribute to the work that New South Wales Health with our multicultural communities have done over the last little while, recognising the excellence in multicultural health communication across New South Wales Health and health-funded non-government organisations. These awards were established back in 2003, and I'd like to commend the ongoing leadership of the New South Wales Multicultural Health Communication Service in developing and promoting multilingual health information to address the needs of culturally and linguistically diverse communities across our state. As always, these awards are incredibly competitive, and it's gratifying to see the outstanding range of work that again has been undertaken this year. I'm also pleased to note that there's a new category this year relating to pandemic response in response to COVID-19. The past 2 years have been particularly challenging for us, and this award ceremony gives us the opportunity to celebrate the adaptability of New South Wales Health workforce and the resilience of our culturally and linguistically diverse communities. The work of Multicultural Health Communication Service in partnership with COVID-19 Communications Team, with the SHEOC, the State Health Emergency Operations Centre, Multicultural New South Wales, and the Department of Customer Service has highlighted the importance of accurate and trusted communication with multicultural communities during the COVID-19 pandemic. It has also highlighted the importance of working with community and faith leaders to co-design health information so that it is accessible and relevant for their communities. This has resulted in COVID-19 health-related information for communities in over 60 languages. Providing clear, consistent, and accurate information that respectfully addresses people's concerns is key to engaging them in health initiatives and programs that improve health and wellbeing outcomes. We have all witnessed the enthusiasm of people from culturally and linguistically diverse backgrounds in taking up opportunities to protect themselves, their families, and their communities against COVID-19 through the vaccination program. This serves as a powerful reminder of the importance of information and communication to promote partnership and action in the pursuit of better healthcare and healthier communities. I'll hand back to you. Thanks, Janice.
Well, thank you so much, Toby, for that very warm welcome. It's now my great pleasure to introduce our next speaker, who leads the wonderful team at MHCS. Lisa Woodland is the Director of the New South Wales Multicultural Health Communication Service, as well as Priority Populations at the South Eastern Sydney Local Health District. Please join me in welcoming Lisa Woodland.
Thank you very much, Janice, and good morning, everyone. I'm also joining you this event from the lands of the Gadigal people of the Eora Nation, and I'd also like to pay my respects to elders past, present, and emerging from Aboriginal communities. I'd also like to pay my respects to people from refugee and migrant backgrounds who've come to Australia to make it their home and to contribute to our rich and very successful multicultural society. I just have a few thank yous this morning. First of all, I'd like to thank the Health and Social Policy Branch at the Ministry of Health for their ongoing support of the awards, as well as all the teams across New South Wales who have submitted applications. We appreciate that it was very challenging to submit applications during the peak of the pandemic, and we really appreciate the effort that you applied to this. We also really appreciate the time taken by our finalists to record their video contributions via Zoom during the lockdown period. Thank you for rising to this challenge, and we look forward to viewing the videos today. Lastly, I'd like to thank the judging panel who had the unenviable task of identifying the finalists and choosing the winners in each category. Our judges were Ashley Young, Manager, Multicultural and Refugee Health, Hunter New England Local Health District. Dana Muad, Program Lead, Strategic Partnerships and Programs, Western Sydney Local Health District, and the Sydney Health Literacy Hub. Kirsty Struthers, who is the former Stakeholder Manager from the COVID-19 response team at the Ministry of Health. Mandy Williams, Acting Director, Population Health, Southwestern Sydney Local Health District. Nick Sandraco, Senior Policy Officer, Health and Social Policy Branch at the Ministry of Health. Randa Katan, Chief Executive of the Arab Council Australia. And Vesna Dragoya, Director, Sydney Healthcare Interpreter Service, Sydney Local Health District. Finally, I'd like to thank my wonderful and industrious team at the Multicultural Health Communication Service for all their work behind the scenes. And in particular, I'd like to acknowledge Sam Shen, our Media and Communications Manager, for her outstanding efforts in coordinating these awards. So thank you, and back to you, Janice.
Well, thanks again, Lisa, for those generous words. Indeed, it has been a very Tough job for the judges to sift through these quality entrants, all of those in the running for these prestigious awards. Thanks again to you. And as you mentioned, your dedicated team at MHCS, we know how much everyone's been working behind the scenes to get these awards happening. So thanks again for your efforts in delivering Multicultural Health Communication Awards and your work indeed with multicultural communities. It's now my great pleasure to introduce our guest of honour today, the Secretary for New South Wales Health. She is a very, very busy woman. So please welcome Ms. Elizabeth Koff. We are honoured to have her here with us today to present the winners of the Multicultural Health Communication Awards. Ladies and gentlemen, please join me in welcoming Ms. Elizabeth Koff.
Thank you very much, Janice, and I'm delighted to be here. I'm on the land of the Camaragal people here at St Leonard's, probably just down the road from Janice when I think of where SBS studios are. So I'd like to acknowledge their stewardship of the country for over 40,000 years and pay my respects to elders past, present and emerging. I think both Toby and Lisa summarised all the recognition and all the importance of these awards. And I've been a huge fan of these awards for a number of years and worked very closely with the team in multicultural health communication. So thank you for your contribution to our endeavours. As we know, the health system exists for everyone, but accessibility to it and communication to it is sometimes challenging if people are from culturally and linguistically diverse backgrounds. And this is where multicultural health communications comes to the fore. One of the hallmarks of the pandemic was our requirement to be responsive and change and move in an agile way as information and data changed. And at no other time has our communication been so critical to protect and promote and maintain the health of the whole of the community. So thank you very much to everyone involved in those endeavours. But what some people do occasionally forget, the health system still had business as usual through the pandemic, and the criticality of us continuing to inform health consumers, patients, the community about the importance of ongoing healthcare has been absolutely critical. So I'd like to really make a strong shout out for the extraordinary work to support our COVID endeavours and the ongoing work of the health system. And I'd like to congratulate all the applicants because everybody is worthy, but as we're well aware, there can only be one winner. So Janice will do the introductions and I have the easy task of pretending to open an envelope and make an announcement, but you're all worthy recipients, so thank you.
That's wonderful, Elizabeth. Thank you so much. It's so wonderful to be reminded really again about the challenges and importance of equitable access to healthcare. So thank you, Elizabeth, again for that. I think your enthusiasm for the job that you do really shines through, and we're very, very, very thankful that you could join us today. And again, highlighting just how important equitable access to healthcare is and just how critical it's been, particularly during the moment, handling a global pandemic. Thank you, Elizabeth. Elizabeth, of course, is going to be not too far away. She will play a very important role today. So without further ado, it is time to present the finalists, and then Elizabeth will announce the winners. So is everybody ready? Are we ready? Yes, here we go. Let's start with the category Keeping People Healthy. Here's a video of the finalists.
Congratulations to the team who was behind the development of the theatre plays Magdi and Love, Hope and Life. The two plays are part of the larger community-led domestic violence prevention founded by the Commonwealth Department of Social Services. Performing arts was used as a platform for community engagement and education. The plays, co-designed with and performed by the community, challenge traditional attitudes towards women, and encourage a collective stance against domestic violence. The plays have been staged live and also recorded to be used as an educational awareness tool to help prevent domestic violence through many more community-led local activities.
We developed the resource HIV, What You Need to Know, in response to the findings that in 2020, 51% of HIV notifications in New South Wales were attributed to people born overseas. It's an easy-to-read, in-language, quality health information booklet, which helps CALD consumers to access, understand, and use HIV health services. This resource also supports health services to be responsive and accessible, and addresses common concerns for consumers needing the services, such as HIV stigma and misconceptions. We made sure the information in HIV, What You Need to Know, was culturally appropriate and relevant by using community consultations, focus group testing, and peer review. We also set up an advisory group, and our client support workers ensured the lived experience examples were respectfully and accurately portrayed, yet confidential.
Did you know that cervical screening is safe during pregnancy? This is the key message being promoted to women in our Cancer Institute New South Wales funded project that aims to increase cervical screening during the antenatal period for women from culturally and linguistically diverse backgrounds. The resources produced for this project include a poster for display in GP surgeries and maternity services, which includes information in 6 community languages, and a social media video available in 13 community languages. Our resources were co-designed with women from culturally and linguistically diverse backgrounds for women from culturally and linguistically diverse backgrounds. Pregnancy presents an ideal opportunity for women to review the need for cervical screening with their primary healthcare provider. Cervical screening saves lives.
Well, congratulations once again to the 3 finalists. Isn't it wonderful to get an insight into the tremendous work being done to encourage all of us to live healthier and happier lives, because all of us, of course, reap the rewards of this tremendous work. I'd like to invite Elizabeth to announce the winner.
Thank you, Janice. And I'm delighted to announce that the winner for Keeping People Healthy is Sydney Local Health District for their HIV multilingual booklets. Congratulations.
How wonderful. Thank you so much, Elizabeth, and a huge congratulations to the team from Sydney Local Health District. I appreciate the hard work that's gone into that initiative. The booklets look fantastic. They are so engaging and informative. So well done to everyone involved there, and indeed our 3 finalists. Huge effort. Next is the patient safety first category. So without further ado, let's check out the video of our finalist.
A cancer diagnosis can be stressful for patients and their families, and especially for those who have limited English and are unfamiliar with the Australian health system. The Cancer Institute New South Wales Patient Information Multilingual Web Portal is a first-of-its-kind resource designed to increase the cancer literacy of people from diverse communities affected by cancer and empower them to be more involved in their care. The study phase showed that often reading literacy was low in the native language of a target audience, and that sometimes written in-language content was not enough. The portal caters to this understanding by also providing plain English pages with links to information in 8 languages on a multimodal, multi-platform format that provides written, video, and audio content. Languages were prioritized by research into number of people affected by all types of cancer from different countries of birth, as well as healthcare interpreting services data. Rigorous testing with communities throughout the production process was also key to getting messages right across readability, tone, gender, pace, and selection of inclusive imagery.
Well, congratulations and thanks once again for that really wonderful effort. But I'd like to invite Elizabeth to officially announce the winner.
Thank you, Janice. I'm delighted to announce that the winner for Patient Safety First is the Cancer Institute in New South Wales for their patient information multilingual cancer information web portal. It is a big mouthful, but an extremely useful tool, I think, to gain access to information for cancer sufferers. Thank you, Janice.
Thank you so much, Elizabeth. Congrats once again to the team from Cancer Institute New South Wales. I think you can see, can't you, the amount of care, attention, expertise showcased in that web portal that the teams produce there. Most of us have an experience of one sort or another of cancer, don't we? Either directly ourselves or perhaps a loved one, a colleague, a friend. We've seen what happens. We've seen them having to go through that to navigate this wealth of information. It can be very, very daunting. So I can't thank the team at Cancer Institute New South Wales enough for helping to assist people who are feeling so vulnerable, helping them to navigate all of that the cancer diagnosis might entail. So well done, Cancer Institute New South Wales, for that incredible resource that people can tap into. Our next category is transforming the patient experience. Let's watch the finalists of the videos of the finalists rather.
Over 70% of the Fairfield residents speak a language other than English. So we decided that we needed to have something implemented at the hospital for better improvement of signage and wayfinding. Through executive rounding and commitment between the Community Participation Manager and the peak body, the Community Participation Network, we decided to improve our wayfinding signage, not only for people who could not speak English, but also for people with low vision impairment. The wayfinding signage was decided to be in the top 3 languages based on the interpreter data that was used at Fairfield Hospital. A lot of consultation and feedback was conducted not only between the peak body network, but also through staff, patients and carers. The first implementation phase was rolled out in 2020 October, and we decided to further roll out throughout the hospital based on the feedback that we got, that the new colour was very vibrant and the signage was very clear and easy for wayfinding for everybody. This project has also highlighted benefits to this for other facilities and districts who are looking to also implement the same project in their own workplace.
I'd like to introduce a new audio recording in English and Macedonian, Relaxation for Multicultural Communities, that has been implemented as part of a 7-week pain self-management program with the Macedonian community. In Australia, there are no relaxation audio resources for Macedonian speakers. The resource aims to retrain the brain to relax using culturally appropriate imagery. It takes consumers on a journey to their country of origin, back to their young age, in a beautiful green world, free from worries or pain. The participants provided positive feedback on the efficacy of the audio recording, and we were able to lower depression and anxiety scores. The audio recording can be used for improved mental health in times of COVID and social isolation. It can be translated in other languages and applied in any multicultural therapeutic groups statewide. Consumer testimonials include: "Thank you for respecting our culture through this unique recording and helping us feel relaxed and connected."
I'm here to introduce our multilingual function for clients to request appointments directly on our website. Due to COVID-19, we had to remove the option for clients to drop into our clinic, but we realised this created further access issues for our cultural and language diverse clients, as it left them to try and navigate our phone or website system to request a booked appointment. H&E Sexual Health collaborated with the Multicultural and Refugee Health team to fund and create this website option. This allows the client to select from 6 languages in a drop-down menu to request their appointment. This information is emailed directly to the clinic, who then contacts the client via a 3-way phone call with a health interpreter to book the appointment to best suit their needs. We also partnered with our local HARP team and web designer to create and boost social media posts on our clinic Facebook page to promote this option to the wider community. This concept has the potential to be used and tailored to all health areas to increase service accessibility for all cultural diverse clients in a sustainable and cost-effective way. This project is one example of how health can become more visible and interactive online to provide innovative access to all services. Thank you.
Congratulations to our 3 finalists. Again, it's so lovely to see such heartfelt engagement with patients who might feel that they need that little bit extra support and guidance. Every single one of our finalists is doing very impressive work to explain the kinds of assistance that patients can access. And we're hearing that a lot through this event, the need and just how vital equitable access is, that clear, concise, information that they need is really, really so important. So I'm heartened to see that so many of these resources are also now being used outside of those particular local health districts, and that the wider community can tap into some of these resources. So well done to everyone involved for making it more equitable, and so that a lot of us can access these amazing resources that are being made. Well, I think it's time to pass over once again to Elizabeth to find out who the winner is.
Thank you, Janice. And 3 excellent finalists. I must admit, I'm looking them quite diverse, but the central theme and why I like this category particularly, transforming the patient experience. And that's something we're really actively trying to develop within the New South Wales health system. Customer service should be as important as healthcare as it is at the local supermarket and at the bank. So well done to all the teams. And I'm delighted to say that the winner of the Transforming the Patient Experience category is Fairfield Hospital in southwestern Sydney Local Health District for their wayfinding signage. Well done, Fairfield. Thanks, Janice.
Thanks again, Elizabeth, and a huge congrats once again to the team from Fairfield Hospital. Elizabeth did a great job of explaining just how vital that service is. And so thank you for providing those extra resources for people in your area and beyond. Thank you so much. Our next category is pandemic response, COVID-19. Now, this is a new category. I'm very excited to see how people have contributed. So let's see a video of the finalists.
I'm going to talk about Going for a COVID Test children's booklet. This booklet was developed to support Western Sydney families of young children prepare for a COVID test and reduce any fear and anxiety associated with the test. It follows the gorgeous 4-year-old Georgie and her mum as they explore testing options available. We worked with the community to develop the booklet, which has been translated into 7 languages, and it's had a really positive impact, not only with Western Sydney families, but further afield. It's reached over 30,000 Western Sydney children, and it's been shared across other LHDs in other states and even in other countries. 70% of respondents said it helped reduce fear and anxiety about having a COVID test, and it also encouraged parents and grandparents to have a test. We've received comments from children such as, "My mum went to the doctor for a COVID test and I told her not to panic." During the current Delta wave, when more children are having a COVID test, the booklet continues to be read by families and helps demystify the testing process and encourage people to get tested.
Our team used two-way communication as the main method for developing resources, with a focus of engaging and empowering our diverse communities. This approach enables communities to be part of the solution, making our effort inclusive and meaningful. Our resources are short in-language videos, audio messages, translated information, and a number of creative approaches that help communities understand and access COVID-safe messages. The approaches include the COVID Safety Champion Model and COVID Safe Small Business Project.
As part of COVID-19 communications campaign for culturally and linguistically diverse communities, we published more than 700 multilingual assets and 745 media across more than 20 priority languages. This strategy improved the health literacy of culturally and linguistically diverse communities to access, understand, and use COVID-19 safety information to make informed decisions about their health. The multi-strategic project used multilingual posters, flyers, social media, videos, and radio broadcasts in priority languages to send accurate and up-to-date messages about all aspects of the government pandemic response. This helped to counteract the large amounts of misinformation being circulated. Consultation with community leaders and representatives ensured campaign materials were culturally relevant, timely, accurate, and in language.
Congrats to our three finalists, a brand new category, which is informing and empowering communities to help tackle a very unwelcome intruder who has changed all of our lives, of course, COVID-19. Now, obviously, the work that we've seen there is life-changing, it's life-saving work. That information, clear and concise information that all of us can access is vital right now. And I'm always struck by the incredible achievements being notched up by some unsung heroes in our community. This is a chance to celebrate them. And we really see the hardworking members of medical and health fields stepping up, taking on this new fast-moving global epidemic and conveying some of those vital health messages so that none of us are left behind. It means that all of us, regardless of our socioeconomic background, ethnic, cultural background, all of us have access to the sort of service, advice and resources about COVID-19 that we need right now. Over to you, Elizabeth, to announce the winner.
Thank you very much, Janice. And two comments I'd make. Number one, I hope we don't have to have this category next year. That would be my heartfelt desire and wish. But the second thing is the amount of work that's been done is absolutely extraordinary. And I feel sort of reluctant to announce a winner because so many parts of the health system responded to communicating the message around the pandemic response for COVID-19. And the agility with which they moved and responded to it was extraordinary. And I'm proud of everyone that's been involved in every single initiative. But unfortunately, I have to comply with the judges' requests. And then we'll announce that the winner of the pandemic COVID-19 category is Population Health in Western Sydney Local Health District for their Going to Get a COVID-19 Testing Clinic children's booklet. Well done, Western Sydney. Thanks, Janice.
Thanks so much, Elizabeth. Yeah, a very, very tough category to choose a winner from. Of course, everyone's done fantastic work and we really hope that you can keep it up. As Elizabeth said, we hope this category isn't around next year. We shall see. But well done to everyone for the incredible resources they've produced. And I should say a very special congratulations to Western Sydney Local Health District for their superb work. Keep it up. Let's move on to the individual awards. This next category is the Staff Member of the Year Award, a very covetable and highly prized award. So let's hear about our finalists in this video.
Dr. Jan Fizel. From the onset of the COVID-19 pandemic, Dr. Jan Fizel has been at the forefront of the public health response. She has worked tirelessly to support and advocate for every segment of the New South Wales community, and her commitment to the development of multilingual health information has been exemplary. From participating in regular community engagement forums, Facebook Live sessions and webinars, to providing expert feedback and advice on countless resources, Dr. Jan has gone above and beyond to share the public health information with a broad range of stakeholders. As well as promoting vaccination and COVID-safe behaviors, Dr. Jan has played a pivotal role in protecting multicultural communities from misinformation. Her innovative and approachable nature has built trust amongst community leaders and helped to ensure key issues and concerns have been heard and directly addressed.
It's a pleasure to introduce Dipti Zachariah, statewide and specialist services team leader, Multicultural Health, Western Sydney Local Health District. The COVID-19 pandemic has challenged our ability to effectively connect with diverse communities. Building trusted and respectful relationships at the grassroots level and with broader stakeholders was necessary to keep communities well informed and safe. Dipti initiated many community-centered strategies by engaging leaders and influencers in developing and delivering appropriate solutions and credible messages that empowered communities and improved their access to timely information. Dipti has a profound respect for individuals and communities as important partners who bring unique knowledge, experience, and expertise that can influence change and support health organizations in developing impactful solutions.
I would like to introduce Mohammed Arif, who works at STARTS as a mental health literacy and suicide prevention project officer. Some of the reasons I have nominated him for the award include his long-term and significant work with his Hazara community. He assisted the Afghan community to understand COVID-19 when it first emerged in March 2020, receiving up to 100 phone calls daily from community members, which we used to create an audiovisual resource. He was an important partner with multicultural and environmental health teams in a bilingual education program to increase community understandings of COVID-19 in relation to businesses. And then while he's impacted by the current situation in Afghanistan, he continues to significantly support and advocate for his community.
So there we see some of the best individuals who are rightly heralded and celebrated for their magnificent achievements. I really loved also seeing some of their colleagues, that heartfelt praise. That was so lovely, that generous and bountiful praise coming from people they work alongside. And that's really so much of what I love about these awards. There's so much positivity and recognition for the hard work that people are doing out there. I'd like to now hand over to Elizabeth to announce the winner.
Thank you, Janice. And I feel the same with this category. It's hard to pick one out of it because the work by all three demonstrated the extraordinary grassroots level activity that was required as we managed COVID. And that was part of our strategy. Western Sydney did have the highest case numbers, and we needed bespoke strategies for the multiplicity of communities involved. So well done to the teams. I am advised there are two winners we will announce. The first winner is Dipti Zachariah from statewide and specialist programs team in Multicultural Health Western Sydney Local Health District. And the second winner is Dr. Jan Fazell, the Senior Medical Advisor for Public Health Response Branch and the Chief Health of the Chief Health Officer here at the Ministry of Health. And I know personally, Jan went out and did so much work with the communities in southwestern Sydney and Western Sydney, for which I'm greatly appreciative, because it really helped us manage the pandemic response. So congratulations to those two winners, Dipti and Jan, and I'd still like to acknowledge Arif for the wonderful work that was done. Thank you, Janice.
That's fantastic. Thank you again, Elizabeth. And I can see that a lot of people on the chat side of things are really singing the praises of all of our finalists and people who have been part of these awards ceremony. I can see that someone here is saying, amazing work by all, but can we please clone Dr. Jan? So there you go. There's lots and lots to celebrate, and so much accolades and applause going on in the comment section, which is really great. And I hope that people are also dipping into their social media platforms and also singing the praises of these magnificent people there as well. But congratulations once again to Dipti Zachariah, and indeed the one and only, I think there's only one for now, I don't think we have quite cloned her yet, but Dr. Jan Fazell, congratulations. Our next category is Volunteer Community Member of the Year category. Let's hear about our finalists in this video.
Nazrin is one of our senior community reps that we have with over 12 years experience, and is also bilingual. She sits on many of our peak committees and also on an executive level at a district for the Consumer Community Council. She participates in many quality projects as well as health literacy projects and auditing as well for us at the hospital. She also contributes in staff training to improve the overall knowledge of community participation. The reason I nominated her for this award is for her exceptional work in helping us roll out our latest patient experience survey into the top 10 languages. Her participation and consultation and feedback, and also taking it back out to her community, was instrumental in helping in the rollout of this survey. She's also a key member to help us with our accreditation process. She's very passionate about her work and is available at short notice, and she helps us in the overall process of delivering better healthcare to our patients, carers, and community.
We have nominated Marcel as a volunteer for his contributions to our program, in particular his development of a digital literacy project in helping the CULD community raise their awareness and understanding of digital aspects. He's used his skills as a photographer and videographer to really get that project going and get it out to the community. And we'd also like to acknowledge his response and his contribution to our COVID response. Being on a border town between New South Wales and Victoria, it's really important to keep up to date with the restrictions. And he's been able to translate and get out messages in language to our community to ensure they are able to understand the current restrictions. Marcel really embodies the principles of Red Cross, and for that reason, we've nominated him.
It's my pleasure to introduce to you Badger Weber. Badger works for our organisation as a registered nurse and has been with us for 11 years. As well as working for us, Badger also volunteers for several community groups, the Riverwood Community Centre, Canterbury Bankstown Harmony Group, and the Nepalese Federation Society. Badger speaks to individuals and community groups about COVID-19, what symptoms they need to look out for, where they can get tested, and where they can receive the vaccine. Badger is helping to care for our community, both in her professional life and her personal life. She's an inspiration to us all.
So there you can see some of the most selfless, magnanimous people we have among us. We can't thank these lion-hearted folk enough, and we can only hope that the rest of us, all of us, draw inspiration from their incredible, compassionate and humanitarian work. And so lovely once again to hear from those who have nominated these people for this particular award. But I'll hand over to Elizabeth Koff once again to announce the winner.
Thank you, Janice. And 3 exceptional nominations for this volunteer award. And I don't think we can underestimate the value of volunteers. They do it selflessly, and especially I think over the last 12 months in the time of COVID, it has, I believe, been a lot more challenging for volunteers to come forward. Understandably, self-preservation is an important attribute that we've all been keen to comply with. So well done to all our diversity of finalists there. But the winner is Nazrin Delshad from Fairfield Hospital, Southwestern Sydney Local Health District. So congratulations to Nazrin, and another award to Fairfield Hospital. You're doing some things well out there. Look, in conclusion, I'd just like to say it's really impressive, both the diversity of languages that all this communication and initiative has been addressed at, but also the diversity of health issues that we deal with. And I think that's what adds another complexity and layers of dimension to what we're dealing with, the multiplicity and the rich cross-section of cultural and linguistically diverse populations we have here in New South Wales. But health itself is a very, very complex area in terms of prevention and well-being and care and treatment. So I congratulate everyone for their extraordinary work. Thank you to the organising team, the judges once again, and of course to Janice. Thank you very much for adding a bit of star power to the event for this afternoon. So thank you.
It's an absolute pleasure. And thank you again, Elizabeth, for being so gracious, such a fantastic person, the only person really who's worthy of handing out these awards. So thank you so much. And congratulations, of course, to Nazrin. Your outstanding contribution and passion for what you do really shines through. We can't thank you enough for your work. So well done. And to all the winners and finalists, congratulations on your extraordinary achievements. We also want to congratulate all the individuals and organisations that submitted their applications for the awards. I always look forward to this event, as I believe they're a salve for the soul. And don't we need it right now? Thank you so much. It means the world to us here that there are good-hearted, talented, experienced people doing vital and important work to help all of us lead more healthier lives. This is life-changing and life-saving work. So you can't get more important than that. I'm so humbled to once again have been part of this incredible event. Thank you to everyone involved. I'd like to take the opportunity to thank Elizabeth Koff for presenting the winners once again, as well as Toby Wilson and Lisa Woodland for being with us here today to celebrate these magnificent people. All the videos you've seen today and this recording of the award presentation will be available to download by visiting the Multicultural Health Communication Service website. That's www.mhcs.health.newsouthwales.gov. So please check it out. And for anyone who couldn't make it, you can direct them towards there so they can check it out. We invite you to like the Multicultural Health Communication Service social media channels. Remember to use that hashtag Multicultural Health Awards. The New South Wales Multicultural Health Communication Service would like to acknowledge the support of the Office of the Minister for Health and the Secretary for Health, Ms. Elizabeth Koff, and her team, and also, importantly, to the New South Wales Health Media team. They've done a tremendous job, fantastic job. So thank you, guys. And ladies and gentlemen, thank you, everyone, for your tremendous help. MHCS would also like to thank the Health and Social Policy Branch and the Multicultural Health Services right across the state for their continuous support of the Multicultural Health Communication Awards. I'd like to take this opportunity to thank you for being part of this very, very special event. I'm so glad we can cheer and celebrate something in 2021. Appreciate all of your efforts. I'd like to give a big thank you to New South Wales Multicultural Health Communication Service team for their wonderful work in showcasing the outstanding multilingual health resources for multicultural communities. Thanks again to all of you. Thanks so much for tuning in. I can see the comments section is still running hot. Lots of congratulations out there. So well done. Just keeping this going. I can't thank you enough. My name's Janice Peterson. Don't forget, tune into SBS World News 6:30 for your best dose of news. But for now, thank you so much for joining us. We hope to see you again next year. But for now, stay safe.